communities across our country have had crisis centers that are accredited with the National Suicide Prevention Lifeline program that's very successful. What Beacon has decided to do is get involved in that. We actually became accredited by the American Association of Suicidology and NSPL. And we have created, as sort of an extension of our national call center, an actual crisis center. And so what we're trying to do with the mandate coming for 988 to ensure that every state has a mental health crisis line, we are offering our support to actually field those calls in various places across the country. But just like NSPL, these are not fully licensed individuals. There's some, but they're not all fully licensed. They're trained as crisis counselors, but they're what we call paraprofessionals. And so that model is much more realistic in terms of being able to handle high volumes of calls with clinical supervision, of course, and oversight there for the staff. So that's one area where we're using paraprofessionals with peer support. What we're doing is, in some of the Medicaid contracts that we have, is setting up a peer support role, an actual official role, like a parent advocate, somebody who actually has children who are in Medicaid services that is actually helping other parents. Start Kids, which is a specialized Medicaid product in Texas, we rolled that out for plans in North Texas several years ago. But this is actually where, managed care and the legislators, I think, met nicely, is that it was built into that product to have a parent advocate position. And so that's what we did, is we hired parent advocates, and we worked very closely with them and looked at ways to integrate them into the case management that we're doing. When that happened, they were going off traditional Medicaid and then going to be managed by a managed care company. There was a lot of anxiety around that change, and the parent advocate was able to allay quite a bit of that. We're inviting those folks and peers to our committee meetings for their input and feedback about Medicaid services and what's needed. We're seeing a shortage of fully licensed individuals, certainly in Texas and actually across the country. So this is a way to continue providing the services that are needed.